I'm Esmeralda Garcia. Welcome back to our daily news. Today we're going to be discussing the most common type of cancer, skin cancer. According to NIH Medicine Plus, there are three main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Basal cell carcinoma, which is the most common out of the three, is found in basal cells, which are located at the bottom of the epidermis, another name for outer skin layer. Squamous cell carcinoma is found as a tumor on the outermost layer of the skin, or the epithelium. As for the most deadly type of skin cancer, melanoma begins in the melanocytes, which are skin cells that produce the pigment known as melanin in order for us to tan. Skin cancer generally affects a specific population, but there may be some exceptions. Skin cancer's main target are those who have non-exposed skin with less pigment, or those who have an inability to tan. In other words, white men and women have a higher chance of getting this cancer. In fact, according to the Cancer Organization, a black person's survival rate is 93, while a white person's is only 69. Although people with lighter skin tones are more likely to get skin cancer, anyone can get this type of cancer. In the end, the sun's ultraviolet rays are considered to be the main cause of skin cancer. 90% of all non-melanoma cancers are due to the exposure of UV rays, meaning that anybody who is frequently outdoors without protection can be at risk. A person that is also at risk but is not outdoors is a person that uses indoor tanning beds. Someone that frequently uses indoor tanning beds before the age of 35 increases their risk of melanoma by 75%. Now talking about age and gender. Studies have shown that skin cancer is very rare in both female and male children and in most teenagers, but as a person passes their teenage years, their chances increase, especially if you're a male. According to the Skin Cancer Organization, in ages 15 to 39, men are more likely to die from melanoma than women are. Skin cancer can be transmitted through physical touching, nor is it contagious, but it can also develop with the help of specific genes. According to the National Cancer Institute, some pathogenic variants in genes that have been associated with skin cancer are CDK4, CDK6, and BRCA1, the former being a major cause of breast cancer. According to Dr. David Adams, many researchers have found rare variants of POT1 in melanoma family pedigrees. If we take a closer look at this pedigree, we can further understand how skin cancer can be transmitted, although it is rare. In this pedigree, POT1 is shown as TYR89CYS, starting on the second generation and continuing on to other generations after that. In generation 1 and 2, we can see that there were other types of cancers, including breast cancer, as it was mentioned before. But it wasn't until breast cancer was present that this variant was observed. Although the variant POT1 was present in generation 3 and 4, only one offspring was diagnosed with skin cancer, this one being the one marked as WT in third generation. Although we have seen that this may be possible, this only occurs with 1 out of 20 skin cancer patients. Another way that skin cancer can be affected by genetics is by the skin color that is passed on to offspring. Everyone has the same color agent, melanin, but we all have it in different amounts. Parents that only code for dark colors, which in this case is shown by dominant A and dominant B, will only have dark-skinned offspring. Parents with genes that code for light skin, which in this case is shown by recessive A and recessive B, will only have light-skinned offspring. However, if any of these genes are coded together, creating a heterozygous genome, then the result would be a medium-skinned child. The darker the offspring is, the less chance it has of getting skin cancer, although it is still possible. Whether skin cancer is genetic or not, it is important for us to be able to detect it at its early stage. Some of the only symptoms of skin cancer are physical moles, sores, lumps, or unusual growths on the epidermis. Ways to examine these growths are by color, appearance, and size. The size of these growths can be concerning if its diameter reaches 6 millimeters. Similar to a pencil's eraser. The colors on these bumps can either look normal or unusual, making this inefficient. For example, a cancerous mole can look either black or brown, but it can also look red, blue, or even purple. Unlike a normal non-cancerous growth on the skin, these growths will have a waxy or shiny look to them, in addition to visible blood vessels. Furthermore, if a growth appears to be asymmetrical, meaning that one side of the growth appears to be different than the other, then this can also be a sign of skin cancer. If any of these signs are found, then it is important that you get it checked by a dermatologist. According to the American Academy of Dermatology, the only way to diagnose skin cancer is with a skin biopsy. During a biopsy, part of the growth will be removed and sent to a special laboratory where it will be examined under a microscope. The results will then be given back to your dermatologist, who will inform you of possible treatments if needed. Some possible treatments of skin cancer include excision, electrodesiccation, cryosurgery, or even radiation. During excision, a surgical procedure in which an area is numbed is performed in order to remove a growth along with some surrounding skin. Similarly, during electrodesiccation, a tumor is removed, but the remaining surrounding skin is exposed to electricity in order to kill any remaining cancer cells. Cryosurgery is the process in which a tumor is frozen and eventually killed with the use of liquid nitrogen. If a tumor can't be removed, another option for a patient can be 15 to 30 sessions of radiation treatment. According to Dr. Otto Plastic, since these procedures are done in an area very close to muscle and bone, they can cause bone to thin and muscle to tear away. This results in a negative effect towards the skeletal system and the muscular system. Eventually, a patient can suffer from joint pain and inability to move. As a result, the patient will have to remain physically active in order to enhance their movements. Some other body systems that skin cancer can affect are the immune system and the integumentary system. The immune system is in charge of protecting our body against foreign invasions. If skin cancer reaches the bone marrow, then there will be a decrease in white blood cells made in order to fight these invasions. Although this may lead to a foreign attacker, the major body system that skin cancer affects is the integumentary system. The integumentary system is made of the skin, hair, nails, and exocrine glands. The skin is the organ that is in charge of acting as a strong barrier and as a sensory receptor. The hair and the nails on our body extend from either the hair follicle or the nail matrix on the skin, and further reinforce the skin from any environmental damage. The exocrine glands are in charge of producing sweat, oil, and wax in order to cool off and moisturize the skin surface. Together, all of these organs work together to protect the inner organs and tissues from outer damage, along with carrying out important functions such as temperature regulation and secretion of waste and water. Out of these organs, the skin is the one that is mostly affected by skin cancer. This organ is made up of three main layers: the epidermis, the dermis, and the hypodermis. The epidermis is the outermost layer of the skin and also the place where skin cancer begins. First, skin cells start to overgrow and build up on the top layer of the skin. Eventually, this buildup will cause a tumor, and with time, you will start to encounter waxy or even patchy bumps on the surface of the skin. If the cancer isn't treated fast enough, it will then move deeper into the next layer of skin, the dermis. Since the exocrine glands and the nerves are located in the dermis, cancer can mess with them and prevent them from performing their functions, causing the skin to lose moisture, along with its ability to sense heat, cold, and touch. Finally, skin cancer can reach the final layer of the skin, the hypodermis. If this occurs, then the cancer can make its way into the blood vessels and spread to other organs of the body. These body systems aren't the only factors that are affected by skin cancer. According to Dr. Ronald Shelton, skin cancer can make its way into the bloodstream by affecting the blood vessels found on the layers of the skin. Since the bloodstream runs through our whole body, cancer cells can easily spread to other body parts, such as the liver, the lungs, and the brain. Overall, we can see that the most common type of cancer can be unfortunate if it isn't treated fast enough. So, wear sunscreen and protect yourself. That's it for today. Join us back tomorrow for more shocking news. I'm Esmeralda Garcia, signing off.